Australian and New Zealand Endocrine Surgeons is a professional association of surgeons who are dedicated to the art and science of endocrine surgery.
It's a wonderful society that brings like-minded surgeons together who have a passion for caring for patients.
We look after patients with thyroid, parathyroid, adrenal disease and other neuroendocrine tumours.
The organisation is a really friendly organisation of great colleagues and great opportunities to collaborate and learn from each other as we all really strive to perform really high quality endocrine surgery.
We are a group of surgeons who share similar passion and vision. As a group, we support each other in developing new surgical techniques to improve patient outcomes, to reduce recovery time, and also to introduce them safely into our clinical practice.
We support each other. There's mentorship, collegiality, fellowship, and learning. We all learn on this journey together.
By working as a team, you bring a vast breadth of expertise to the individual patient's problems so that you can care for them in the best possible manner.
Our members are united by the common goal of achieving the best possible outcomes for our patients, and we do this through rigorous training, making sure that our surgeons are up to date with the latest techniques in endocrine surgery. We undertake research and contribute to the international research, and we also ensure that the next generation of surgeons is well trained so that ultimately patients in Australia and New Zealand get the best quality surgery that they can.
Doctors who need to refer patients for specific problems within the realm of endocrine surgery or endocrinopathy really benefit from the ANZES in terms of being an organisation that you know you can trust. So those who are associated with or are trained by the ANZES are basically trained to a level of expertise that can be relied upon.
One of the unique challenges of being an endocrine surgeon in a region, particularly as a solo practitioner, is staying up to date with medical information and training. The great benefit of having the ANZES behind you is that they organise and coordinate training courses and postgraduate programs that can deliver the cutting edge knowledge that's specific not only to people working in really high level areas but to surgeons practising anywhere in Australia. And what that enables us is to have high quality, well trained and contemporary endocrine surgeons working all across the country, not just focused in metropolitan areas.
The benefits are many. If you're thinking about the referral of doctors, they know by referring to a member of the ANZES that they're getting a high quality, well-trained specialist who has a focus on these particular types of disease which really require specialist knowledge to treat well. The patients also gain the benefits because they are seeing someone who has access to the wider multidisciplinary team as well as their own personal training to provide them with that quality care that they're looking for. ANZES is a great vehicle for the furthering of not only the current standards in endocrine surgery practice but also the future, and that comes in two parts. We have the research and other opportunities that are available for progressing the care of endocrine surgery diseases within Australasia, but also the training of future surgeons who are going to be able to continue with the practice that has been so sort of cutting edge and world leading.
We recruited the brightest minds in Australia and New Zealand from multiple different disciplines to review all the evidence and create evidence-based guidelines for Australia and New Zealand. They're curated, up-to-date guidelines. The benefits of the guidelines are for members to have a resource at their fingertips that they can offer the most up-to-date evidence-based care for any patients needing thyroid, parathyroid or adrenal surgery.
So in addition to the guidelines that we've developed, we also have the Australian New Zealand Thyroid Cancer Registry. It's a fantastic resource that pulls together all of the thyroid cancer work that's being done across Australia and New Zealand.
And by collecting all of that data on new thyroid cancer patients, we can improve outcomes by getting doctors to adhere to guidelines and protocols. It's a clinical quality registry designed to improve outcomes for thyroid cancer patients. Currently we've got over 2,000 patients with thyroid cancer enrolled. We've got sort of 40 sites around Australia and New Zealand and over 60 surgeons contributing.
And it gives us a vast database of information to look at what we're doing well in terms of thyroid cancer management and also what we can do better, and that's to enhance our own personal practices as well as to take the next step to see what can we do better for thyroid cancer patients in Australia and New Zealand.
All the medical and surgical advances that we hear and see every day on a daily basis are the result of years and years of research and development. All the members of ANZES are connected to this network of highly trained and highly skilled surgeons, clinicians and researchers. Collectively, there's a huge amount of expertise, experience and knowledge in the field of endocrine surgery, and that is really good for our patients.
It's really important that general practitioners and patients in Australia and New Zealand who are dealing with thyroid, parathyroid or adrenal problems seek out a highly experienced specialist in that area, and that's what the Australian and New Zealand endocrine surgeons offers.